ED can take over your entire life. I know, I lived it. I suffered in silence for years. Don't make the same mistake I made. Get your life back. You're about to meet a remarkable doctor who can explain how.
You don't really pick the specialty picks you.
Dr. LeRoy Jones could have done anything in medicine. He's trained over 1,000 other doctors on penile implant surgery. He's been on training missions to 16 countries and counting. Jones is president-elect of a national organization for doctors in his field. He's done around 2,000 implant procedures and does well over 100 per year. The credentials are there. Dr. Jones chose urology. Why?
You see the results, you improve quality of life.
Changing lives in men like me. My erectile dysfunction was so bad from diabetes I'd given up on sex. I reported and traveled the globe as a TV reporter and hosted a network health program for years. But ED haunted me, crippling my self-esteem. If you're suffering like I did, hear these words. I tried pills, suppositories, injections.
ED has a subtle way of taking over your entire life. Things that used to interest you no longer do, and stuff that used to seem easy becomes a chore. But if you're like me, you probably have no idea how much ED is impacting you until after you take action.
What changed my life? An implant. A small device I control that lets me enjoy sex when I want to, with total confidence, a natural feel or sensation, and privacy. No one needs to know about my implant unless I tell them. It works on demand. Think about that. A natural erection in seconds. The procedure often takes less than an hour, and most men go home within 24 hours. An implant, also called a prosthesis, is simple to use and works.
One of my patients calls ED not erectile dysfunction, but erection on demand.
Jones trained at the source.
I was fortunate enough to train at Baylor in Houston, and so that's where the implant was invented by this guy, Brantley Scott. So I got to work with him for a year before he passed away. He was able to really sort of help me improve my surgical skills for the more complex cases.
He's an expert sought around the world. He views ED as a quality of life issue. If you needed a hip replacement, you'd get one. If you have diabetes like me, you'd treat it with insulin. Why should your sexual health be any different?
The youngest guy I put an implant in was 28, and the oldest was 91. He sends me a birthday card every year on his birthday, telling me that he had sex on his birthday. And so, you know, when he was 91, he sent it. When he was 92.
An implant from American Medical Systems can change your life, restoring hope and joy. Learn more about implants at edcure.org.
It has a very, very high satisfaction rate. Consistently, it's over 90% for both patients and partners. So satisfaction is paramount. I mean, I've been doing this long enough that I believe in the surgery. I think it's important to have a surgeon that believes in the operation and somebody that's done a lot.
Remember, implants equal hope.
It's remarkable, right? But my ED is now a thing in the past. Yours can be too. To learn more, visit us here.